addressing the needs of your senior family member. This program is part of Apprisen Staying on Track, providing financial education. Let's find out more. How many of you had this conversation with your family, or how many of you are currently facing issues? I know this conversation can be hard to have, but sometimes starting with things like, I don't want to upset you, but if something happened to you, I would want to know that your wishes were being honored. It's important because without legal documentation, such as a will, belongings and estates can be divided by the court, where a judge will decide who gets what assets. A verbal decision will not count. First, let's take a look at everyone's role. For the parents, you need to get organized. You need to know where your finances are and what they look like, what investments you have, what insurance policies, debts, and other things. You also need to communicate that with your siblings and loved ones. And then you need to create a plan. What you were thinking of doing as you get older. Are you looking at changing housing, or are you looking at living somewhere else? Also, what you would like to have for your burial arrangements. For adult children, this is a very tough conversation to have. You need to be empathetic. You need to listen. Encourage your parents to act. Become their advocates. Be on their side. But you need to be sensitive. And you also need to help the parents create a plan, because there'll be a lot of little things that will come up that they may not think about that you need to encourage them to put into their plan. Some of the topics you may want to discuss are finances, scams, legal issues, medical issues, housing, and burial. For the finances, you'll want to talk about some basics first. Savings, investment accounts, life insurance information, bank account information, and the names of their financial advisor. Also, you can look at getting a trust together. A trust would be so that if something would happen to them and they can no longer make these decisions, someone is appointed and has the authority to make the decisions. Beware of scams. There are lots of different types of scams out there. Embezzlement is one where maybe a social worker or someone who's helping out has got access to accounts. The same thing is true with identity theft. Many times older people are not protective of things that can be used to steal their identity. Telemarketing fraud and sweepstakes abound. Many times seniors are contacted, they've just won a lottery or some type of sweepstakes that is fraudulent, and they're asked for their account information so that money can be deposited. Investment scams, many people, again, that are older will be contacted by people looking for investments and telling them how they can double or triple their money easily. These, again, are usually scams, and all that's going to happen is they will lose their funds. And in today's world, Medicare fraud is taking on new meaning. With the new Affordable Health Care Act coming, many seniors are getting called on the phone mentioning that now with the new Affordable Health Care Act, their Medicaid will no longer be valid, or they're going to need more coverage, and insurance policies are sold that really do nothing to help them at all. Just like any other area of life, planning things out will help you reach your desired end. With addressing the needs of seniors, legal issues will definitely come into play. It's important that these open conversations are about what they wish, but wishes can only be treated legally and officially if they're documented. So you need to make sure that you get an attorney that understands elder law, and also that you talk to them about living wills, trust, and other topics we will discuss in a few more moments. A living trust is an arrangement in which you name the person, called a trustee, to hold the legal title to your property and funds. In most cases, you are the trustee, keeping full control over all your property that is held within the trust. Upon your death, a new trustee, which you have identified, will carry out the wishes that you have indicated. A will is a document containing instructions and your wishes on how your property, assets, and estates are to be distributed after your death. Durable power of attorney gives designated persons the authority to make legal and healthcare decisions on your behalf. Without this document, if you become incapacitated or incompetent, your family will not be able to make the important decisions regarding your finances and your health. A healthcare durable power of attorney works in conjunction with advanced directives to do things like not to resuscitate or not to force feed or put you on medications that you do not want. Advance directives refer to the treatment preferences and designated of a surrogate decision maker in the event that you should become unable to make medical decisions on your own behalf. Do not resuscitate orders is a document that instructs healthcare officials that no steps should be taken to restart a person's heart or to give them breathing again if they stop. Following your wishes in your living will and your healthcare directive will help physicians when you become incapacitated and can no longer make those decisions. A living will describe and instruct how you want your end of your health care to be managed. It is one type of advance directive that takes effect when you are terminally ill. Medicare is something that you need to help your parents or loved ones understand as well. You can get on the government website for Medicare and understand Medicare Part A, B, D, all the terms, so that when they have questions or when questions do come up, you'll be able to assist them and be able to help them get the answers. You may also want to consider long-term care insurance. It helps provide for the cost of long-term care in generally some areas that aren't covered by health insurance. So this is something else to help look into and talk to your loved ones about. Housing is something else that you may have to consider modifying. You may have to consider moving phones or other items in the house. Also, you may have to provide them ease of access for things like getting in and out of bathtubs. If there are stairs involved, maybe ramps would have to be put in if they want to stay in the house. But the other option may be for them to downsize and look for a smaller home to move into. That way there's less yard to keep, there's less house to keep, and it will also save them in taxes, utilities, and other costs as well. And if that doesn't work, again, you can talk to them about living or moving in with you, but be very careful if you do that, because that can put a huge strain on your family as well. Trying to care for someone that has medical issues would be very, very difficult for most people to deal with every day. They may be better going into assisted living or nursing homes. Assisted living, a lot of these places are set up so that they are pretty much apartments. People can take care of themselves, even cook for themselves. But if they need help, help is available to do things like cook or clean. There's also communal dining areas, activities and recreations that they can become part of. And if financially they're looking at some problems and they have equity in their home and they're over the age of 62, they may want to consider a reverse mortgage. This is a way that they can use that equity to be able to afford the lifestyle that they now have and keep it current. You will need to look into reverse mortgage, as there are scam companies out there with those. And also reverse mortgage rates are expensive. One of the nice things is you will have to go through counseling, or your parents are going to have to go through counseling before they can set up a reverse mortgage, and that's something else that Apprisen can assist with. Funerals can be very expensive. Make sure you discuss what their final wishes are. This is always a difficult conversation to have, but the sooner you have it, the better, and you'll be able to make those arrangements and set it up the way that they want. Watch out for people who are looking to make profits from pains. That's why you want to try to pre-arrange funerals in advance if you can, because during that time of stress that we all would go through after the loss of a loved one, it's harder to make those financial decisions and look at them objectively. So what are some signs that your parents may need help? Well, if you notice bruising from falling, and again, it may not even be falling, but just bumping into walls or furniture. Older people tend to bruise easy, and if you see that, that could mean that they're having trouble getting around, or they're having trouble with dizziness, things like that. If the house is in disarray, again, they're just having trouble keeping up with normal housework and routines. They may need assistance, or you may need to bring in assistance to have them be able to keep the house in normal order. Not eating, if they start losing weight drastically, maybe it's because they just can't prepare their own food anymore, or if there's no food in the house, they can't go to the grocery store. Drinking or taking sleeping pills, pain pills more frequently is a problem that a lot of older people run into. They're in pain, so rather than go to the doctor, they just start to use more pills than what they should. Not socializing, again, if it's hard for them to get out, that's a problem, but they need to be able to socialize. They need to be able to lead as normal lifestyle as possible. And buying useless items or hoarding. Again, we see a lot of older people because they're sitting at home and they're watching TV all day, and the home shopping channels, QVC, all of them prey on these people, and a lot of times they will buy things that they really don't need and end up spending and wasting a lot of funds. There's many other factors to consider as well, driving safety being one of them. Usually older people don't want to give up their ability to drive, but obviously if they're driving erratically, it could not only cause them physical harm, but others as well. So maybe suggest going somewhere and asking them to drive, and that way you can just observe and see what they're doing. Medical safety, again, this is very difficult for sometimes people to take care of themselves. Medications can become confusing. Which ones do I take when? A lot of times pills look very much alike. You can buy very inexpensive pill dispense systems so that you could lay their pills out for them a month at a time for both morning, noon, evening pills, whatever they have, to make it easier. Financial safety, and again, we've talked about some of the different things, but can they manage their finances on their own? If they cannot, will they allow you to help them make those decisions? Look for evidence of unpaid bills, late notices, and things like that. That's telling you that they have not paid them, have not been able to keep up. Daily living activities, can they perform all the things that they need to do besides keeping the house? More important things like bathing and other things around the home. And home safety, as our parents become older, they become more frail, and carrying heavy objects upstairs, getting around the house can be very, very difficult. So you may need to look at modifications to the home if they plan on staying there. Some resources to help get that support: day programs. These programs offer everything from Meals on Wheels and other things where someone could come into the home, be able to help older people exercise. There are actually daycare centers now for adults where they can go be with others in their age bracket, and they have all kinds of exercise programs, discussion groups, arts, crafts, health education things as well. Hospitals are very good at coming up with wellness programs. You can check with your local hospital and see if they have wellness programs available. They could include things like fitness centers or exercise programs. A lot of the senior programs are done in swimming pools, so there's less impact. And also, if they offer education programs, you may want to go with the elder person so that you can sit in and understand what the information is being given and help explain it to them later on. In-home companions, these are visits from social interaction peoples. They might include running errands, helping with shopping and cooking, but they do not address any personal care needs. Home health would address that personal care need if people are no longer able to take care of themselves adequately. It could be anywhere from a few hours a day to 24 hours a day, and these things are provided by nurses and home health aid workers. Senior living, we talked earlier about senior living centers, and they can help a lot because they can offer a lot of different options, from independent apartment housing through assisted living and through skilled nursing. They have communal dining and daily activities. Housekeeping and laundry are also available to be able to help the senior continue on living a normal life. If you're still nervous about taking on something like this, just understand that you need to get support. First of all, support from other family members. If there are several children, then you all need to get together and talk about this as a family or a group. Or even if you're an only child, maybe there's other family members that want to be involved, whether it would be an aunt or an uncle that you have, or an older person that's a close friend of your parents. Physicians, with the new HIPAA laws, they're going to have to give permission for you to be able to talk to the physician, but extremely important because, again, many times as people get older, they don't understand what the doctors are saying, and you'll need to be able to understand and help them, so you'll need to be able to talk to their doctors. There's case managers who will help, social workers as well. We talked about the need for getting and understanding and working with the legal side, so you'll need to have lawyers and ask them questions, and they can help you through this process. And also financial advisors, so that you can get help setting up budgets, looking at their investments and other things. And sometimes very good to go talk to your local retirement communities, your local assisted living homes, because they can give you a lot of good information. There are many resources available on the web today that can help you through this process as well. Go to caringinfo.org, as they can give you a lot of different ideas, directives, and advice as to how to talk to the parents, how to get this subject started. We talked about the need for legal, and there are attorneys that specialize in elder law. And if you want to try to find one in your area, you can go to nationalelderlawfoundation.org. And if you click on your state, it will bring up a list of attorneys for the different areas in your state that have people that specialize in that. Centers for Medicare and Medicaid Services are at cms.gov. Another great website is the U.S. Administration on Aging, and you can go to eldercare.gov. And again, a lot of great information on how to help care for seniors and some of the resources that are available to them. If you would like to find out more about reverse mortgage, go to the HUD website, and you can also go to AARP, as they have quite a bit of information about reverse mortgage as well. And going to AARP's website, they have a very good PDF file that you can print off there to set up these programs. It goes through and gives you a list of things to talk about. It goes through and gives you a list of things that you need to do, along with things like the trust that we talked about. And also on there, a lot of other lists about little things we haven't talked about but need to be done. For instance, if they're staying in their home, what about home maintenance? And they have it set up by times of the year so that if it's fall and the leaves are starting to come down, is somebody going to be able to clean out their gutters, or is that something that you'll have to have somebody come in? So the AARP website, again, is a great website to go to do the research and find out more available resources for you. And once again, we invite you to our website to get information, or you can always give us a call at 1-800-355-2227. There you'll find information on financial as well as many other topics to help you. And also, please remember that you can join us on Twitter or also on Facebook and get valuable information that way.